Assalamu alaikum. Good morning. Hello, everyone. So thank you, everyone, for joining me in this free introductory live session about preparation for MRCOG Part 1 exam. This is Dr. Muhammad Helmy. I am the head of department of Part 1 MRCOG courses, admin exam expert. And it's my pleasure to be with you today for giving a brief about how to start preparing for MRCOG Part 1 exam, and also to introduce our different courses for this particular exam, inshallah. So I hope you get the maximum benefit from the information given today. So I'm going quickly to start identifying the exam. What about MRCOG Part 1 in general? How to prepare? I'm going to answer a few questions which come to your mind frequently. These are frequently asked questions, okay? Also, I'm going to show you how to prepare, what are the best strategies to prepare for the exam. Then by the end of the session, I can listen to your questions and answer as many as possible, inshallah. So first, it's my pleasure to have my dearest friend, Dr. Desiree, in this course. We are cooperating together since like 2018, okay? And we have been in this journey together for a long time, and alhamdulillah, we are doing our best effort for making this course better and better every batch. So inshallah, Dr. Desiree will be joining me in this course. She is our brilliant mentor in microbiology, genetics, and of course, statistics, which by the reviews of everyone, whether in part 1 and part 2, they can see that how easy statistics is after joining Dr. Desiree's workshop in statistics. So inshallah, we are going to be together also in this batch, and we are going to show you the timeline of our courses in a while. But let me first talk about the MRCOG exam. Of course, we know that the MRCOG is the internationally recognized the qualification or standardized qualification for the ops and gynae career in the UK. And of course, some other countries can identify this prestigious degree and also help the doctors or the colleagues to improve their career, and I mean CV also, for joining or having job opportunities in many other countries. Of course, this exam is 3 parts, as I think all you know, that we have part 1, part 2, and part 3. Part 1 usually talk about the basic science, and then we have part 2. Part 1 is only single best answer, and of course it's a computer-based exam. MRCOG Part 2 is also computer-based, but it includes single best answer and EMQs types of questions. And then we have Part 3, which is the oral or the OSCE exam, in which you are going to talk up to role players and have 14 stations. Some of them are simulated patients, like you are going to talk to a patient or a role player who acts like a patient. And also there are 5 stations which are called structured discussion, like you are going to discuss the questions with the examiner. Of course, to take part 1 and part 2, all you need is just to be having your graduation certificate, no other requirements. But of course, in part 3, you need at least 4 years of experience in the OB-GYN. So you have to send to them a proof or an evidence that you have completed at least 4 years of a job in OB-GYN with what we call the assessment of training form. And of course, when we talk about the main exam about the knowledge of OB-GYN, of course, it's part 2. So even if you are able to take part 2 exam immediately after part 1, it should be taken after you have a good clinical experience. I mean, part 2 is the main exam which will ask you about your knowledge in OB-GYN. Part 1 is more related to the basic science. And part 3 is more related to how to communicate with the patient. So in my point of view, that part 2 is the main exam, or we can say the hardest step among all 3 steps. But inshallah, with good preparation, every step will be easy, inshallah. So, of course, related to part 1 exam, MRCOG part 1 covers the basic science and applied science relevant to the clinical practice of OB-GYN. Of course, we talk about basic science, yes, anatomy, physiology, endocrinology, and so on, but which is helping us in our practice. Also, in this exam, we have 2 papers. This exam is 200 questions. These 200 questions are divided into 2 papers. Each one is 100 question or 100 mark. And there are no negative markings, okay? No negative markings at all. So that's a good point, that if you even don't know the answer of one question, you can guess it, no problem, okay? And regarding the passing percentage, it's not fixed, but it ranges from like 66% to 68%, maximum 70%, okay? And I have never seen that 70% many patches before or many exams before, because usually it's like between 67, 68%, like that's the passing percentage, but it's not fixed because it depends on the exam difficulty, the number of candidates, and so on. So this is variable, but of course, when we talk about preparation, you have to prepare very well, like you are going to get the 100%. Of course, no one can get 100%, but I'm saying that you have to put that in your target. I mean that you have to make a perfect preparation. So when you target 100%, you will get 95%, 94, 92, 90%. It's okay. You are going to pass, or you will guarantee your passing. Okay. But if you like study, like I'm going to get 70%, you may, get 60 or 65 and you may fail the exam. So of course, good preparation is the key to pass the exam. Of course, the exam is scheduled 2 times every year, January and July, but this year they make it like January and June. It will be on the 30th of June, the next exam. So we have one in January 2026 and we have one in 30th of June 2026. I don't know if it will be fixed every year, January and June or not, but I think like this exam maybe in the last days of June or the first few days of July. So I think it may vary from one year to the other, but in 2026, inshallah, the first exam will be on 14th of January and the other one will be on 30th of June, okay? So let me also write this. Like we have the one will be 14th of January and the second one will be on the 30th of June. And of course, all the information is written on their website. Okay, so these are the main subjects related to the part 1 MRCOG. That's the syllabus: anatomy, embryology, genetics, physiology, endocrinology, biochemistry, and biostatistics. And these subjects usually come, or their questions come in paper 1. And each paper, of course, is 2.5 hours. The second paper includes the questions of pharma, pathology, microbiology, immunology, biophysics, clinical management, and data interpretation. And also this paper is 2.5 hours. So I will give you a brief about the main topics under each subject, like for anatomy. Of course, when we talk about anatomy, so what do you think? For our practice in the OB-GYN, we will focus, of course, on the anatomy of the pelvis and mainly focusing on the female genital system. And when we talk also about the anatomy of the pelvis, we talk about the pelvic vessels, pelvic nerves. Also, we talk about the perineum, and also talking about the pelvic bones and ligaments and so on. Also, it's important for us, as we are also surgeons and we're doing surgery, to know the anatomy of the anterior abdominal wall. And also there will be some other miscellaneous points regarding the anatomy of the breast, anatomy of the pituitary gland, for example, because it's related to our practice as well. These are some of the topics which will be covered under anatomy. In embryology also, we talk mainly about the embryology of the female genital system, and also talking about the embryology of the urinary tract and the early embryogenesis, the development of the embryo from the time of fertilization until the formation of the different organs. Also, we have the physiology and endocrinology, and of course, endocrinology, we talk about the reproductive endocrinology, and the physiology, we talk mainly about the changes occurring during pregnancy, the physiological changes occurring during pregnancy. Also, we are going to talk about the metabolism of different elements like carb, protein, fat. This is under biochemistry. And we have pharma talking about the main medications we use under the OB-GYN practice, pathology of the female genital system, microbiology. Also, we talk about the different viral and bacterial infection, immunology of pregnancy, general immunology, talking about the basic points about immunology, biophysics, things related to the ultrasound and diathermy, things we use in our practice. And of course, the clinical management is like having an information or a summaries of different or important clinical guidelines and data interpretation, like how to read an APG, how to read a urodynamic chart, how to read an ECG, CTG. These are the main points or topics. I think if Dr. Desiree, are you joining me? Yes, Dr. Desiree, I think she is here. Can you hear me, Dr.
Dr.
Desiree?
Helmy, I'm here. I can hear you.
How are you doing, Dr. Desiree? I think Dr. Desiree now can also talk a little bit about genetics, statistics, and microbiology. Just give them a brief points about the main topics we give under these important three subjects, Dr. Desiree.
Okay, Dr. Helmy. Of course, in genetics, we have to discuss the most controversial pedigree analysis. So in this course, you will be taught on how to analyze the pedigree of autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive, mitochondrial, and Y-linked. So all of those will be discussed under genetics. And not only the pedigree, it will also be we will also be guiding you on how to make a prenatal genetic diagnosis, which on which time you should choose amniocentesis, chorionic villus sampling, chordosynthesis. So it will be discussed during the course. And what else? The most common single gene disorder, like your Down syndrome, your Patau, your Edwards. So any genetic disorder will be discussed also in the course. So by attending the course, you will be expecting that you will be getting all the knowledge that you need in order to pass the MRCOG Part 1 exam. For microbiology, we will be, of course, discussing the infectious diseases, Okay, all kinds of infections, viruses, bacteria based on the latest guidelines. We also have your parasitology. Everything under microbiology will be discussed. There will be also important algorithms that you need to know, especially in chickenpox, GBS, okay, herpes. We incorporated the recent guidelines in the lectures, okay? For the biostatistics workshop, we have 5-day biostatistic workshop in which we will be discussing everything about biostatistics. In MedExam, we consider everyone as zero knowledge in statistics. So don't worry, I know everyone is afraid. And when they say biostatistics, I don't know anything. I become a doctor. That's why I don't like math. So in the course, in the workshop, you will be taught as if we will consider you as if zero knowledge in statistics. So everything about epidemiology and biostatistics will be discussed during the workshop. So if you will notice later on when Dr. Helmy flagged the pre-course materials, you will never see any topics on biostatistics because the biostatistics pre-course or any recording or any PDF or any webinars will be included in the workshop. Okay, so don't worry about it. We will be discussing in biostatistics on how to choose the um, screening test, how to choose the correct study design, how to interpret forest plot, how to choose the, the, the correct, how to interpret graph. Okay, so everything will be discussed. How to compute for your likelihood ratio, odds ratio, everything. We will be providing you all the formulas. So don't worry about it. And we will be giving you 200 questions high yield about biostatistics. And in this workshop, you will be joined by part 2, MRCOG people, and those who are not joining the course. So this is a separate course, which is included in your course, in the regular and the progressive course. It is included as part of your course. Okay, so don't worry, you will be having all of this when you enroll with MedExam Expert. Okay, if you have any other questions for genetics, biostatistics, and microbiology, kindly reserve them after Dr. Helmy finish the orientation webinar. Thank you, Dr. Helmy.
Thank you, Dr. Desiree, for this nice brief points about these important subjects. Don't worry, everyone. I'm going to answer all your questions in the chat box, okay? But I just want to make sure that the voice is clear from my side because someone is saying, Dr. Asma is saying the voice is distorted. So I want to make sure from other colleagues that I have no problem in the voice.
I can hear you loud and clear.
Okay, very good, very good. So please, Dr. Asma, check your internet connection from your side. So, of course, you need now to start, if you haven't done this step yet, to make your account on the official website of the Royal College and start making the eligibility application. And of course, before you can enter the exam, you have to send the eligibility form. And then after that, you can fill the expression of interest form and start booking for your exam. And of course, these are the important dates and deadlines for the January 2026 exam. Of course, the eligibility deadline is by the Friday, 29 of August, 2025. So you still have time to apply for the eligibility. Then the expression of interest by Friday, 9 September. The booking window will open on Tuesday, 21 October and closes on Tuesday, 9 of December. The exam, inshallah, will be on 14th of January, 2026, and the result will be released on 11th of February 2026. So these are the important dates regarding the January 2026 exam. So before going through your specific questions, let me share first some of the frequently asked questions. A lot of candidates and colleagues ask about the difficulty of MRCOG exam in general. Is this particular certificate or exam is difficult? Of course, I don't believe that there is something difficult if you do your best and prepare well, okay? Because these exams are designed to test your knowledge, okay? How you deal with your patients, how you can be a better doctor. So it's not something impossible to pass, okay? This is a standardized qualification exam. And when we say standard or international exam, so it suits everyone, okay? Yes, difficulty can be variable among the different steps, okay? Like for part 2 in particular, I'm saying it can be considered the hardest step because it needs like more effort from your side to cover all the important guidelines. And of course, we have a lot of guidelines and papers we need to read before the exam. So that's why it's a little bit harder than other steps. In part 1, the syllabus we can say it's somehow we have margins, I mean, for this syllabus. We know what we have or what we need to cover for part 1. But for part 2, every year we have new talks or new papers released from the Royal College. We have new guidelines, so you need to be updated. So that's why part 2 a little bit harder. And this is, the main step where the examiner tests your knowledge. So that's why it needs good effort from your side in part 2 in particular. In part 3, now we'll come to another step, completely step. Yes, you are tested or your knowledge is tested, but it's not the main aspect of the exam in part 3. In part 3, they want to test your ability to communicate with the patient, how you talk to the patient, how you show sympathy to the patient, how you break the bad news and things like that, okay? So the difficulty is variable, but in general, many colleagues finished already the MRCOG exam, and of course, all you need is just to organize your time and make it an important target to finish, okay? So how to prepare for this exam? And now I'm talking in particular about part 1 and how much preparation is enough. Of course, I'm going to talk about the preparation in a while, but the duration of preparation also depends on your routine or your daily routine. We always say that from 4 to 5 months of preparation, 4 to 5 months of preparation is very good for part 1 MRCOG, okay? Some people even can do the preparation in shorter times, like in 3 months. But as I always say, it depends on your routine. So if your routine is heavy, you have a residency, for example, and you work most of the days and you have long shifts and so on, it may be difficult for you to get free time every day to study. So you need to start preparing earlier than usual. But if your job is like somehow calm or you don't have this heavy routine, you can focus in 3 to 4 months to finish preparation. Also, a lot of colleagues ask about how many questions are repeated in exam, because some colleagues, of course, because they are so much busy, and they don't have the time to read the theory and read all the concepts. They want to answer questions and answer the previous exam questions and so on to get or to take the new exam. But of course, the percentage of questions repeated also can be variable. In some exams, you can see many questions repeated, and other exams, you can see more new questions, okay? It depends. So I don't recommend this strategy. I don't recommend this strategy. Yes, we are going to answer, of course, the previous exam questions, but we are not depending on this. We need to have clear concepts. So in case we have new questions or newly designed questions, we can deal with these questions. But like 30, 40%, this is per minimum questions, of course, will be repeated from previous exams, maybe more, but I don't recommend this strategy. I recommend the one who will take the exam to have clear concepts and also answer the previous exam questions. Why? Because I always say it's not about passing the exam. It's about getting better in your career. You need to be a better doctor. So if you don't get a personal benefit from these certificates or these exams, they will be just like titles. after your name. But at the end, if you work in any place, they will discover that you don't have the qualifications to work, okay? And that's not the purpose of the exam. The purpose of the exam mainly is to make you better doctor, okay? So you need to prepare well. Of course, you can prepare for the exam with a full-time job and kids. Yes, like, of course, we all have commitments. We have family commitments. We have work commitments. But of course, you can make at least 2 or 3 hours per day to read and answer questions. You can even have, now we are all using our tablets and cell phones and everything. So you can put your material and you can access websites, you can access groups on your cell phone, and even during your job, you can open your group and answer some questions. You can read whatever you want, but you have to make this. If you need this certificate, if you need this title, you will make time for that, okay? What are the best books to read for the exam? I'm going to talk about the preparation in the next slide, but I will move to the next question. If I haven't worked in OB/GYN, can I pass the exam? Also, this depends on the effort you do for reading theory. For part 1, yes. If you are a fresh graduate, you didn't start your OB/GYN residency yet, yes, you can pass part 1 with more effort reading the basic science and so. But for part 2, it will be a hard job, by the way. Like, if you are reading guidelines and you are not practicing this will be difficult. I'm not saying it's impossible, but I'm saying it will be difficult. And what is the point that you are reading something you don't practice, okay? So of course, the more clinical practice, the more clinical experience you have, of course, the easier you are going to find while studying and reading the guidelines and so. So for part 1, I think, yes, you can, if you are still in the internship or the house officer year, I mean, yes, you can pass the exam, but for part 2, it will be somehow difficult. For experience, as I told before, no experience needed for part 2. The experience now is only needed for part 3, at least 4 years of experience to be eligible for part 3 exam. And the documents you need for part 1 and part 2 is just the eligibility form you do for part 1 and the graduation certificate. And for part 2, all you need is just expression of interest. Part 3, you need to send your experience certificate and the assessment of training. Of course, for each part in Mid-Exam Expert, we do an orientation for each part. So don't bother your mind now for part 2 and part 3. If you need to know more about them, inshallah, after passing part 1, you can join the orientations done by our colleagues in other courses. So let's talk about the different books in the market, okay? And then I will show you how to prepare. Of course, we have some theory books and some SPA books or question books. Unlike part 2, okay, part 2 has many books in the market, especially for questions. Part 1, a little bit, the questions in books are limited, or the number of books released are limited. So for theory, we have many books like revision notes. This is a summarized book, but it's somehow, or it's an old book. It's the last one is published in 2011, so it's not updated. We have this essential revision guide book. We have the basic science of obstetrics and gynae of Philip Bennett, and we have the Oxford Basic Science for OB/GYN, and we have this book of Dr. Richa. These are famous theory books, and also in Egypt we have Dr. Ahmed al-Bahouti book. These are theory books, and these are the question books. Get through 400 SPA, MRCOG of Andrew Caesar, and the Anschrout question. Of course, also we have the online question banks. We have different online question banks like Strategy. This is the official one of the Royal College. We have PASM, MRCOG, and so on. These are different question banks. Of course, here I'm talking about the colleagues who like prefer to prepare by themselves. So what they need to do is to I'm asking you just to make sure to mute your mic to avoid any interruption of the recording. So for the colleagues who prefer to prepare by themselves, of course, they will access or they will have the books and to read the different topics from the different books. Like the problem is, or in part 1 in MRCOG in particular, that are like, for example, if I want to know like the anatomy of the female genital system, if I open, for example, the basic science book, maybe I have summarized information, but when I open essential revision guide, I have more detailed information. So you need to do your own, source. I mean, you prefer to read this topic from this book because it's written in this book very well, but you are going to read another topic from another topic because you see that it's written better here than there. Okay, so you are going to do this collection from the different books. Okay, and for the guidelines, of course, we pick up not all the guidelines. Of course, we have some important guidelines. These are related to the basic practice. I mean, if you are newly starting your job, you need to know how to deal with a case of preeclampsia, for example. So you need to know about the preeclampsia and gestational hypertension. You need to deal with a postpartum hemorrhage, how to deal with a case of postpartum hemorrhage, how to deal with a case of vaginal infection. Okay, so it's some topics you need to know some information about. So these will be collected from the different guidelines. So about the topics itself, if you access our free group on the Facebook, you are going to find a post there showing the topics under each subject. So all you need to do is to see the topic and read it from the source you want. How to prepare reading versus practice. Some colleagues prefer to answer questions only. Some spend all the time just reading theory, and of course both strategies are not correct. You have to do this simultaneously. Okay, you have to read and practice, read and practice. Okay, some may differ from by which to start. I mean, like some subjects, like small subjects like biophysics, for example, or biochemistry, these questions are these subjects, I mean, are small subjects, and minor subjects, I mean, they have like few questions in the exam, like 6 or 7 marks for each subject. So some colleagues prefer to start practicing, like they check the questions and know which questions come at each subjects from these minor subjects frequently, and then they go to the theory and read the topics or the related topics. So you can make like a reversed strategy, like practice first to know which topics are important, then go to read the entire topic. This is also a good strategy, but both should be found in your preparation, reading and practicing. Whether to start with reading or to start with practicing, it's okay, whatever you prefer, okay? But you have to do two things simultaneously. And I prefer to read the entire subject, study the topics, then answer all the questions related to this subject. So these are some important advice you have to put in your mind while preparing. First, once you decide that you are going to go through this journey of MRCOG, you have to believe that you will get this title as soon as possible, the MRCOG title. So you have to believe in your abilities, believe in yourself, and start making everything possible to achieve your goal. Okay, you have to study on daily basis. Okay, don't let any day to pass without getting a new information. Okay, this is very important. At least answering like 5 questions. Just read one page, one topic, whatever you can do every day you have to do. Okay, even if you have a heavy day doing the job all the day, before you sleep, just open the group you are following and answer a few questions. Just taking or having a new information each day will help you to pass the exam. Once you join a study group, be an active member, okay? Don't be like just an audience, one of the audience. No, you have to be active. You have to share questions. You have to discuss with your colleagues, with your mentors, okay? And be active in the study group and discuss the difficult topics in particular with colleagues. And this is a very important strategy. When you have a study partner or you have one study group and you can communicate with your colleagues, try to share the difficult topics with them and ask them to like, for example, I can ask my colleague to explain for me one difficult topic. So when you read or listen to the explanation, this will solidify the information in your mind, okay? But don't join a lot of social media groups. This is a matter of distraction, okay? So if you are joining one study or two study groups, that's more than enough, okay? But don't like join here and there and there, okay? This will make a lot of distraction, especially that each study group will have their own pattern of studying and their own schedule, okay? So don't join a lot of social media groups and a lot of platforms in one for one exam, because this will make you distracted. Try to collect your notes in one place, okay? This is very important. And this will help you in the revision phase. Once you have a short time before the exam or restricted time before the exam, you need to have all your information in one place. Like I told you, for example, if you prefer to read from many sources and you read topic number 1 from this book and topic number 2 from another book, don't make this or don't keep the information like apart from each other in many books. This will make you distracted and you will feel lost, and that you may miss one topic to read before the exam. So just collect the notes in one place. Like make a copy of this topic in one notebook and the other topic from a different book in the same notebook, and so on. Or if you write your own summaries by your hand, so write them in one place. This will make the revision easy for you. If you help your colleagues, of course, this means that you help yourself. If you are sharing information with others, others will share information with you. And in these exams, cooperation is much, much better than being alone, okay? Because we didn't pass this exam and we haven't taken this title except because I mean, we have just finished this exams because we had senior mentors who helped us, okay? And they guided us, okay? And now we are guiding our colleagues, and you have to guide others as well, okay? So help the others, okay? This will, of course, makes God and Allah help you in your career, and also you will find other people who will help you and guide you to clear these exams. So remember your aim every day and work hard for it. So this was a general information. And again, I'm saying that if you need more details about the topics under each subject, you can access our free group on the Facebook MRCG Part 1 guide. Now let me talk about the service we are providing for MRCG Part 1. Of course, as I introduced to you in the very beginning of the session, and of course, Dr. Desiree already is here, and she described to you the important points in her subjects. We are cooperating together, inshallah, in this course, along with Dr. Noura, who is our active moderator, who will guide you in the group and answer your questions and make a communication or a link between all of us in or through the exam. And of course, this course is starting on the 28th of July, okay? And this is our timeline. So we usually start by what we call the pre-course activities, and this is for the main course or the regular course. We give you an access for some recordings. This is we call the warm-up phase. We just allow you to listen to some recordings from different subjects in this period from the 28th of July to the 12th of August. Okay, this will just get you into the mood of the study, okay, to know some topics, to prepare yourself for the main preparation phase, which is the live session phase. So it's a warm-up phase. And then we move after that from the 13th of August to 13th of November. This is the live session phase. This is the main preparation phase where we give live sessions, okay, for each subject. But of course, this will be excluding the topics given before in the warm-up phase. I'm saying we are not repeating the same topics again in the live sessions. You will be allowed to study them again, yes, but we are not going to explain it live again. Why? Because this will be time consuming. So we give you some recordings in the warm-up phase, and these topics will be excluded from the live session phase as a live discussion, I mean. But of course, during the study time, you are going to have the time to go back to the recordings again and again. I'm going to show you also the tables in a while, but let me complete or finish the timeline. Then after finishing the live session phase from 14th of November to the 21st of November, we will have the statistics workshop by Dr. Desiree. And as she said, that this workshop is included in our courses, in the regular course and also in the progressive course. So it's not a separate course, but we make it a separate workshop because we want you to focus on this particular subject, because we know that we are not too much familiar with working with statistics. So we need to have the knowledge from scratch, I mean. So that's why we put it in a particular workshop. After finishing the statistics workshop, we will start our revision phase for the regular course, and it will be from the 22nd of November to the 31st of December. The progressive course or the revision course will start on the 25th of October and will be also finishing on the 31st of December. This is a separate course, okay? And after finishing all courses, we will have what we call the recalls workshop from the 1st of January to the 11th of January. This is the final revision phase, focusing mainly on recalls. So this is the timeline of all courses, okay? So for the January 2026 batch, this is the timeline again, but here that's the regular course. We will start by pre-course, then live session phase, then a statistics workshop, then the revision phase. For the progressive course, we have 2 bundles of revision, then statistics workshop, then completing the other bundles of revision, and then the recalls workshop, which is by the way, one of the or included in the progressive course. If you enroll in the progressive course, then you will get this recalls workshop as a part of the progressive course. This is the pre-course topics for January 2026 regular course. Okay, so we gave you these recordings. Okay, for example, for physiology, we have these recordings, endocrinology, this one, and every day you will get access on the website and you can listen to these recordings. And of course, you are going to ask me, so should I finish all these topics in the pre-course phase? Of course, it's better to finish all of them, but if you don't have the time or if you miss something, don't worry, okay? As I said, it's just a warm-up phase. But during the live session phase, we have a time allocated for studying each subject, and I'm going to allocate days or 1 day for going back to these topics again. So you will have the time to go back to these recordings again and to listen to them one more time. So finish as many as possible of these recordings, and of course you will have discussion with the moderator in the group. But if you miss something, don't worry, because even Some colleagues join us late after finishing the pre-course activities, so we will give time to go back to these recordings again and to listen to them again, so don't worry about this issue. Then after that, we have the live session phase. This is the live session. I mean, for example, like on the 13th of August, we are going to start by anatomy, and anatomy is divided into 2 live sessions, anatomy part 1 and part 2 on Wednesday and Thursday. Then we will give you study duration, okay? After finishing the live session, we will allow you to study the subject, and we'll give you a schedule to manage your time during this study duration. We call it the mini schedule. Like on the first day, you are going to start studying the anterior abdominal wall. On the next day, you are going to start studying the anatomy of the female genital system, for example. On the third day, we'll do this. On the fourth day, we'll do this. And each day, the moderator, Dr. Nora, will discuss with you the questions related to this topic. Okay, and this study duration will also include the topics given in the warm-up phase or the pre-course activities. After finishing the study duration, you will have 1 day to access a topic test on anatomy on our website to test yourself and evaluate yourself. After that, we will move to the next subject and so on. Okay, of course, for the topic test, you can answer the topic test as many times as you want, okay? But for the first time, okay, we collect the top scorers for each topic test. I mean, of course, if you answer the topic test for the first time and you get 80 or 85% or 90% or whatever, okay, you will be, if you are from one of the top scorer, you will be included in the top scorer, okay? And of course, by the end of the all topic test, the top scorers of all exams, okay, will get like some rewards or some gifts from mid-exam expert, okay? This is just to encourage you to study and to take the topic test in time, okay? But of course, if you get a higher score with the repetition, of course, this will not be counted, because on repetition, you already know what are the new answers, because, or what are the correct answers, because once you finish the topic test, you will know what questions you already answered right and what questions you did wrong and what are the correction of these questions. So the second and third and fourth attempts will not be counted, okay? So this is just to encourage you to study and to take the topic test and make it like a mock test or as a real test and test yourself very well. So this is for the regular course. Then we have the progressive course or the revision course, and here we have bundles of revision. I mean, we divide the subjects into 5 bundles, and this is apart from the statistics, of course. For each bundle, we doing the reverse strategy. I mean, we give you a study your time. You will study first. You will access the recordings. You will access the materials, and you study by yourself, revise by yourself. Then we have a live session after this duration. In the live session, we are going to answer questions and highlight the most important points in this bundle. For example, bundle 1, including 2 subjects, physiology and endocrinology. So we are going to highlight the important points in these 2 subjects and answer questions live in the session. Then after that, also, we will get a topic test, including the first bundle to test yourself. Second bundle as well, third and fourth, and so on, by the same strategy. Then after that, you will get the recalls workshop. Of course, the statistics workshop, as I told you, it's included in both courses. So if you enroll in the regular course or in the progressive course, you will get the access to the statistics workshop by Dr. Desiree, inshallah. After that, we finalize by the recalls or the revision workshop, where we answer 1,000 plus questions. We focus on the difficult questions and the debatable questions in all recalls. In each day, we will answer 1 year, okay? And through the recalls workshop, you will get 4 meetings with me and Dr. Desiree, 2 meetings with Dr. Desiree and 2 meetings with me to discuss some important points also and answer queries and debatable questions if we have. So we are not leaving you at any stage. We are with you until the day of the exam, inshallah. Of course, you will be supported by a Telegram group. This Telegram group will have the admin team, the backend and technical team, the moderators and the mentors. If you need any help at any time, all you have to do is just share your query or question, and we are going to answer you and help you. On this group, we will have a daily discussion on important topics and questions and any exam-related updates, all announcements, and of course, you will get the access to this group until the day of your exam and even after the exam to have your feedback and your opinion about the exam as well. Also, you will get an access to the website of MedExam Expert, and of course, the backend team and the technical team will help you to explore the website. And of course, there you have the recorded sessions and also all the live sessions given in the courses, whether in the regular course or the progressive course, will be recorded. So if you have commitments and you don't have the time to attend the live session, you will have a recorded session to access after you finish your commitments. You will have a PDF file of all materials. You have the topic test, past paper files, flashcards, which contain summaries of some topics, mock exams, and we will assess your progress on the website, and also you will get access of all things until the day of the exam. So these were the information I wanted to highlight from my side, and I will look now to the chat box, and if you have any questions, also start to share. Okay.
Dr. Helmy,
Yes.
we have questions from the chat box. I'll read it for you. Question from iPhone 15. Can we do part 2 without residency? And related to that, can we do after MBBS?
Yes, but of course you will have to finish part 1, then you can enter part 2 immediately, as I told you in the discussion. Okay, that part 2 needs no experience, like official experience, but I'm talking about the ability to pass the exam. Of course, it will be something you need to make a lot of effort to read without practicing. Okay. So for part 2, yes, officially you can do it immediately after part 1 without any official experience or any other paper you have to provide for entering part 2. Okay. So yes, you can do it after MBBS.
Okay, so there's another question from Zoom. Is MedExam enough, or should I get a past MRCOG subscription? And related to that, Sarina is asking, please guide if MedExam material is enough, or shall we do theory for somewhere else too?
No, of course, you are dealing with the most experienced company, okay, in the field of MRCG courses. And I want to say something. Part 1 MRCG in particular is the first baby, okay, of MedExam Expert. We are doing this course since 2016, okay. All materials of MedExam Expert are collected from all sources you can imagine about part 1. So once you enroll in the course, and you pay for it, you don't have to distract yourself by any book or by any other question bank. Everything you will get from MedExam Expert. So once you get into the course, all you need to do is follow the strategy we provide to you. Okay?
Okay, thank you for answering that question. There's another question from iPhone. What if I'm not doing residency in Pakistan and just clearing MRCOG? Can I still get it? I don't understand what she mean by can I still get it.
Okay, so you can finish part 1 and part 2, but how can you get part 3 without clinical experience? Okay.
Yes.
Yes, so you need clinical experience for part 3 unless you are doing like trying to get an MTI, training job in UK, which is called the MTI. You can apply for that, and you can travel to the UK for training and things. And but you have to have you have to get clinical experience, whatever in Pakistan or any other country, to be eligible for Part 3.
Okay. So a question from Dr. Amara. Part 3 experience, is it continuous 4 years?
Not needed to be continuous, at least 4 years, but with the one condition that at least in the recent 2 years you are working. I mean, like don't like if you are leaving the job or leaving practice for more than 2 years, okay, this will not be you are not going to be eligible for Part 3. You have at minimum at least 4 years of experience, and you have to be working for the most recent 2 years. You will have to be active on work. Okay.
Yes, and I also think that they are asking, what did you do in those 2 years that you did not continue your training? You have to justify that in writing, what you
Yes.
do in those years, right?
Yes. Yes. If you are having job, I mean gaps. Dr. Desiree means that if you have gaps in your practice periods,
Training, yes.
yes, you have to justify these gaps. Why you talk about like or why you have a hold in your job, or why you leave this job and don't work for these months. You have to justify that. Okay.
Okay. There's a question from Dr. Shireen Raza. I'm an average student. I want to know if I just take your course without opening any other books, can I pass the exam?
I will say that we will appreciate your effort if you can finish what we provide you with materials. Okay. Just you will ask us to like remove some of the content after that. Okay, so don't think that we are providing little material. No, we are providing everything. Just finish them. Okay.
Yes, we are providing enough materials for them to pass the exam. But if they want to do an extra effort, we're not holding them back, right?
Yes.
When you study more, that's better.
Yes, of course, of course. We say any effort you do is good for you. Okay, so if you want to read more guidelines, if you want to read more books, it's okay. But at this stage, it's up to you, and you can pick up what you want. But if you talk about the good preparation or the best preparation, just follow the strategy to be able to pass the exam, inshallah.
Okay. The question from Dr. Amara, I think you have answered this already. I have 2 years of experience. I need more 2 years, but my experience is not continuous. Will it be okay? So I think you answered that already.
Yes, you have to
See?
start. You have to
Yeah,
start
yeah.
working, and after 2 years you can apply for the MRCOG Part 3, inshallah. But of course, in this time you are going to finish first Part 1 and Part 2, and then apply for Part 3.
Okay, Dr. Serena is asking, same for MCQ books, please. Shall we buy
No,
any?
no. Don't buy
No.
anything. If you are
Yes,
enrolling
because
in the
we
course, don't.
provide you everything in PDF.
Yes, yes.
So, Dr. AE, I noticed that the recourse workshop isn't included in the regular course, which looks like a bit of a limitation. Does this mean that to get access, you have to enroll in progressive course also?
No, you can skip the progressive course and enroll only in the workshop revision phase, workshop phase, I mean. You don't, if you enroll in the regular course and you don't want to enroll in the progressive course, yes, it's okay. And you can just enroll in the revision workshop. It's okay.
Yes, and I would like to add, Dr. AE, the revision course is not included in in the regular course because the regular course has a different revision workshop. That's why it is not
Yes,
included.
we have a longer revision phase in which we are going to
Yes.
discuss also questions and recalls and everything. So you don't have also, but if you want, you can enroll in the revision workshop alone. Okay.
Okay. From Zoom user, I passed MS Gynae OBS in 2024. 4-year experience can calculate MRCOG part 2 or 3. I cannot understand her question. I think she was talking about when to start the 4-year experience.
Once you started your residency, okay, or training job, this is from the first day you are that the experience is calculated. But MS, I mean master degrees, it's okay. But in the Royal College, they don't recognize or they don't depend on finishing other certificates. All they need from you is the proof of experience that you worked and you finished these operations and you have done labor and you have do myomectomy, have you done hysterectomy, like this, okay? So you have to make this in assessment of training form.
Okay. So, question from Dr. Suhaila Amin. Ma'am, what does MRCOG affiliate means? As my RCOG accounts send me email to become an affiliate. Is it of benefit? I think it's just for access for guidelines, right? If you could correct me, Dr. Helmy. The affiliate means you have more access to the materials that they provide.
Means associate member, right? Associate member.
Yes.
Yes.
Affiliate, yes.
Yes, and to access like the paid materials like strategy and something like that. But the guidelines are for free. But
Yeah.
there are some other contents like some continuous professional development courses and some questions like strategy are for access for members only. But if you want to access them before finishing MRCG, you can pay money and you can be called associate member and you can access these materials. So it's just for accessing more materials on the website.
This includes the TOGs, Dr. Helmy?
Yes, also the TOGs, yes.
Okay. Is progressive course activities access provided to those who have enrolled a course from Samsung SM? Is
No,
progressive course
these these
activities
are these are two separate courses. So if you are in the main course and the regular course, you will not be included in the progressive course unless you want to enroll in it. Okay.
Okay. From Dr. Sobia, as I'm doing residency, is this course enough to pass? I already paid. Quite difficult to go with theory.
Of course, the course is more enough, inshallah, to pass. But the idea of going with theory or studying, okay, this is maybe because you haven't got the schedules and you don't know how to manage your time for now, okay? But once we start the preparation and you will have commitment, like for example, today I'm going to finish this topic only. So the organization of time will be very important, okay, in managing the job and all other commitments. So all you need to do is just make the time for the topic we share with you. Like, for example, today are going to study anatomy of the anterior abdominal wall, for example, and Dr. Noura will share questions about this topic. So all you need to do is going to read this topic quickly. It will not take like just maximum 1 hour reading and then answering the questions with your colleagues on the study room. So this will be more than enough, inshallah.
Yes, Dr. Sobia, this is a very doable exam. Okay, so just follow the schedule. Another question, Dr. Helmy, from Dr. Asma Khan. I am working as a medical officer. Am I eligible for MRCOG 3? Medical officer?
What's meant by medical officer? Because
Yeah, I don't know. Medical officer for OBS Gynae or medical officer for GP or what? Can you clarify your question, Dr. Asma? We
Yes.
go to the next question, Dr. Helmy. After giving 3 parts of MRCOG, can we practice in the UK? Very interesting question. You can
That's
answer
why
this.
that's why we do this MRCG to practice in the UK. Yes, all you have to do is to finish the OET exam, the English test exam, and apply for the GMC. You are going to register for the GMC, you get a license, and then you can search for a job in the UK.
From Dr. Obajobi. Good morning, Chief. Must I have MRCOG 1 to 3 before getting work in the UK? I think it's the same
Yes.
related question.
Hey guys, to work in the UK, you need a GMC registration. Okay, GMC registration can be got by many ways.
Many
Like
ways, yes.
finishing the PLAB or the UK MLE, like which is opposite to the US MLE for the United States, for example, or finishing the MRCS, for example, which is the Royal College of Surgeons. Okay, or finishing MRCOG, whatever the way you get the GMC registration, you can work in the UK. Okay, so MRCOG is one of the ways to get registered in the GMC, and you have to finish the 3 steps to get the registration, okay?
Okay. From Dr. Kainat, I need course details. Please, I want to join Dr. Helmy. I think Ariba is already getting
Yes,
in touch with him.
the team is sharing the information, okay?
From Dr. Basma Adil. Hi everyone. Is your course enough for us to have a full for us as I have full-time job? She has a full-time job. Is the course enough, Dr. Helmy?
The course is done for the people who have full-time job and they are busy to to
Yeah.
make. Yes, that's why we do the course, okay? Because you pay the money to save time, okay?
Yes. Otherwise, why will you have to enroll in the course when you can study on your own? That means you have too much time.
Exactly, yes.
Dr. Asma again, Dr. Asma Khan again write the same. Working as a medical officer eligible for MRCOG 3. I think she's talking about Dr. Helmy about the experience before you take the MRCOG 3. Is a medical officer enough?
I just want to know what is the job description of a medical officer. Okay, this means house office,
Yes.
like the foundation year practice or whatever. What is meant by medic? Because I know the terminologies are different among different countries. You know, so but the experience is calculated, which is the pure experience in
In
OB/GYN result.
OB/GYN, yes.
Yes.
So that means OB/GYN residency or you're working as an OB/GYN
The
already.
exception they can do, the exception they can do that, like if you do a rotation during a foundation year, and you, for example, in this rotation, you get a 2 months, for example, in the OB/GYN department, okay, you can include these 2 months, okay, in your experience, but you have to get the full experience or the 4 years from the OB/GYN practice, okay, not GP, not foundation year, not okay. Uh,
Okay. So let's go to the question of Galaxy A9 Pro. So we are all talking to gadgets, Dr. Helmy. I
yeah.
want to know that GP experience of 4 years exclusively in OB/GYN will work or I must need to get training. So she's a GP working exclusively in OBS/GYN. Will it work as experience, Dr. Helmy, or she need a training for OBS/GYN?
Okay, so GP in OB/GYN, do you have an official or proof that first you have a official proof that you work as a GP in OB/GYN? Because there is like a job description, there is nothing called general practitioner, and at the same time you are
OB/GYN.
experienced in
Yeah.
OB/GYN. Okay, so you may, yes, you may work that like something, in your job or in your workplace, that they know you have some experience on OB/GYN, so they let you see all the cases of OB/GYN only. But do you have an official approval for that? This is the thing. What about the surgical issue, okay, or the surgical part? Have you done the
Yes.
surgical training like operations, labor, and so on? So you have to get proof of that for the assessment of training as well. Okay.
So basically, this is called an MRCOG exam because these are designed for those who wanted to enter into the training of OBS and gynae. So if you are not sure if you wanted to go to your GP and you wanted to go to general surgery or you wanted to go to family medicine, I think this is not the best pathway, right, Dr. Helmy?
Yes,
Because
I
you will
think
stop in after part two. After part two, okay, no problem. But what about part three?
exactly. If you are not sure that you are going to take a residency or a full training job in Ops and gynae, so MRCG will not be the best way for you. Then I think the better is to take the MRCS. Okay, the MRCS is a two-step exam without any clinical experience. Okay, it's like the PLAB. Okay, you can get it. Okay, and then you can register in the GMC, and then once you go to the UK, you can pick up the specialty you want, or according to the job opportunities there, you can take a job in the UK. So if you are not sure that you are going to take a residency or a training or a place to work in OB/GYN field, then you have to think better before taking the path of MRCG.
Okay. So, question from Dr. Olalere, and this is a very nice question, Dr. Helmy. In the previous exams for MRCOG, What percentage of med exam expert candidates passed in one sitting?
Yes, our success rate, mashallah, in part one exceeds 95% now. Okay.
Yeah.
Yes. And
And
you can
I
get the
just,
reviews from previous candidates, mashallah. They are not only
yes,
passing the exam, but they get very high scores. Even more than score like we see 93, 94, 95%. And I think one candidate before got 98% or 97, something like that. So Alhamdulillah, uh,
yes.
our
I
success
don't
rate.
want, I also don't want to brag, but all those courses that are running around now are products of MedExam experts, right, Dr. Helmy? I just don't want to mention what courses are those, but all of them came from MedExam expert.
Yes, by the way, most of the mentors everywhere, they were our colleagues, okay? They were our candidates, and then they became doing their own courses. But Alhamdulillah, many exam experts started this business, and Alhamdulillah, we are keeping the pace and we are doing our best to be on top as always.
Okay, there's another question here, Dr. Sobia again. Any passing criteria for MRCOG-1? I think Dr. Helmy already mentioned this. What percentage needs to meet the pass exam? He already mentioned that the usual average is from 67 to 68. Okay, rarely it goes beyond 70. Okay. So
Exactly.
a follow-up question, Dr. Helmy, from Dr. Olalere. After passing MRCOG-1, do I need to have clinical experience to pass MRCOG-2?
And also no clinical experience official, for as officials or something official to be eligible for the exam, no. But for yourself to pass the exam, it's better to have some clinical experience. But that doesn't mean it's impossible to pass the exam without clinical experience, but you will have to make much effort to read the guidelines and understand them without practicing. But of course, if you have the more clinical experience you get for yourself, it will be helpful in the exam. But as official paper to administrate for taking the exam, no, you don't have any clinical experience required. That's only for
Okay.
pass. Okay.
Okay. Here, Dr. Helmy, from follow-up information from Galaxy A9 Pro, I'm a medical practitioner in multidisciplinary hospital, but I work only in OB/GYN for 4 years, including labor ward and surgical side. And am I eligible for Part 3 MRCOG?
Yes, if you get from the hospital manager, okay, or the HR, okay, letter from the hospital that you work as an OB/GYN doctor in this place, then this is approved, okay? So all you need is to prove this, okay?
Yes. So this one, Dr. I think this is the last question. Sir, the reviews of January candidates, July candidates told that the part one is a new pool and a little tough. So how to prepare for it? And your expertise for new, do you have your expertise for new study plan?
Of course, in each exam, we have new questions, but new question doesn't mean they are coming from new topics or new information, okay? Because they will give you questions from the basic concepts we provide to you. Of course, we make analysis for each new exam in the market given by the Royal College. We make analysis for these questions, and we see what things or what new things, if there are new things, are provided, and we cover them, of course, in our materials. But of course, in each exam we get or we have new questions, but these questions are also coming from the topics or the theory part we provide, okay? The problem is, guys, that although people enroll in the course, not all of them can also read the theory, okay, or they do the effort to read the theory well. They depend on also the questions only, and we always advise them, no, this is not a good strategy. And even and of course, people are variable in their effort. Okay, some people are doing much effort and they get benefit from each information we are providing. Some other candidates are not doing the same effort, maybe because they don't like to do an effort, or maybe because they have many commitments that they are too busy to read. Okay, and even we notice that in the days before the exam they are sharing questions which are discussed many times. So, guys, at a certain point, we as a mentors cannot force people to do effort. Okay, yes, we can guide you, we can manage your time, we can organize things around you. Okay, but at the end, it's your effort. Okay, at the end, it's the way you study. Okay, so the problem is some people still depending more on the questions, like they want the questions to be repeated as it is, okay, without any change. And this is not a good strategy, because of course the examiners in the real college, they have question banks and they do renewal of the questions and they do changes in the questions. So you have to read the basic concepts and to understand the theory part. This will help you to deal with any question, even if they are new questions. But again, we do analysis of these questions and we include them in the new course, so you are not going to miss anything, inshallah.
Yes, and I would like to add, Dr. Helmy, because some colleagues, they thought when they see the question, they thought that it was the exact same question. We don't train them to answer recalls or memorize keys to the recalls. That's why we're teaching them theories so that their foundation is strong, so that when the examiner twists the question, they will still be able to answer. So familiarity of the question is not the same as mastery of the question. They thought it's the same question, but it's actually not the same question, right?
Exactly. Yes. Yes. You have
And
you
we,
have
yeah,
you have
go
to
ahead.
deal with the way of the question it's coming to you, not like with the familiarity of the question. Like if it's the same question I answered before, I'm going to answer it. Once the examiner change a word, it becomes a new question. No, it's not a new question. It's just a new design of the question, but it's the same concept, the same idea. You have to deal with it.
Okay, so we have two more questions, and then maybe we'll call it a day. MRCOG-3 needs independent surgical experience, and or surgeries done under supervision will also be counted. I think it will be counted because you are under training, right, Dr. Helmy?
Yes, yes, it will be counted because the form itself will be signed by your senior supervisor. Okay, so when you do a form, okay, you will get a signing from the senior supervisor who guided you through your training. Okay.
Okay, last question from Dr. Mulki Muhammad. Is Part 3 MRCOG also exam online or not? No, it's not an
It was
online
just
exam.
online in the era of the COVID, but
Yes, in
alhamdulillah.
the COVID it was online, but now it's
Okay.
on-site exam.
Yes, you have to. We have in part three. We have centers now, many everywhere. In of course in the UK, we have in Singapore, we have in the United Arab of Emirates, in Egypt, in Pakistan, in India. There are now centers for the exam everywhere. So you don't have to travel to UK particularly for the exam. You can travel to the other centers if you wish to.
So, are there any other questions, guys? Can we call it a day? Thank you, Dr. Helmy, for a very nice orientation, and I'll see you in the course.
Thank you so much, Dr. Desiree, for your cooperation today and for helping me in answering the questions. Thank you so much.
I'm just
And
reading. You're the one answering.
thank you so much, and see you in the course, inshallah.
See you guys. The back end team will assist you for those who wanted to enroll. Okay. I think Dr. Helmy, you have discount for those who attended this webinar, right?
Yes, yes, I think the backend team shared that there is a discount. So if you want more information, please follow the instructions of backend team and they will guide you. Okay?
Okay. Bye bye, Dr. Helmy.
Bye,
Happy
Dr.
Saturday.
Thank you. Bye-bye. So thank you so much, everyone, for joining me in this free introduction webinar. The team is there to answer any query you want, okay? And of course, if you are enrolling in our course. We are going to start, inshallah, on the 28th of July by the warm-up phase. So once you enroll in the course, you will be added on the study group, where we are going to share with you all the schedules and all the information you need. Again, thank you.
Okay.
Yes,
Bye-bye. No, no, no,
bye-bye.
no. I thought I forgot something.
Okay.
Bye-bye.
Bye. Thank you so much. Bye-bye. Bye-bye, everyone.